Wrong statement about rotational atherectomy. A. Not very useful in calcified lesions. B. Uses a diamond coated burr rotating at high velocity. C. Pulverizes the atherosclerotic plaque into tiny particles. D. Rotation of the burr needs high pressure compressed air or nitrogen. Correct answer A. Not very useful in calcified lesions. Percutaneous transluminal coronary rotational atherectomy is the technique by which a diamond coated burr rotating at high velocity is used to pulverize the atherosclerotic plaque into tiny particles, usually smaller than the red blood cells. PTRCA is useful mainly for debulking of calcified lesions which would otherwise not yield even to high pressure balloon inflations. False statement regarding the assessment of coronary microvascular obstruction by CMR. A. Images obtained 10 to 15 minutes after injecting a gadolinium based contrast. B. Infarcted tissue is seen as a region of hypoenhancement. C. A dark core of hypoenhancement within the infarct tissue is taken as a region of coronary microvascular obstruction. D. The index of microcirculatory resistance measured acutely predicts the extent and severity of infarction in patients with STEMI. Correct answer B. Infarcted tissue is seen as a region of hypoenhancement. Infarcted tissue is seen as a region of hyperenhancement on cardiovascular magnetic resonance imaging after injecting a gadolinium based contrast. All of the following are true about tolvaptan except A. Indicated for treatment of dilutional hyponatremia. B. Useful in SIADH. C. Selective V1 receptor antagonist. D. Should not be used in those unable to respond to thirst. Correct answer C. Selective V1 receptor antagonist. Tolvaptan is vasopressin antagonist which acts on V2 receptors in the renal tubules. Activation of V2 receptors increases water permeability in the renal collecting duct, resulting in passive reabsorption of water. V2 receptor antagonism causes aquaresis or free water clearance. Syndrome of inappropriate antidiuretic hormone secretion, heart failure, and cirrhosis can be associated with increased secretion of arginine vasopressin. This leads to water retention or inadequate water excretion and dilutional hyponatremia. Tolvaptan binds to V2 receptors and induces excretion of electrolyte-free water without altering the electrolyte excretion. All of the following statements about Vernaculant are true except A. Useful in the treatment of recent onset atrial fibrillation. B. Rapidly acting drug. C. Atrial selective agent. D. Acts on calcium channel. Correct answer D. Acts on the calcium channel. Its actions are mainly on potassium channel. It has action on Kv 1.5 channel conducting IKUR current, ultra rapid outward current, and KIR 3.1/3.4 channel which conducts IKACH current. It has actions on ITO, transient outward current, late sodium current, and mild effect on rapid component of the delayed rectifier current IKR. Ivabradine is a beta blocker, B calcium channel blocker, C potassium channel activator, D pacemaker current inhibitor. Correct answer D. Pacemaker current inhibitor. Ivabradine is a selective inhibitor of the funny current or the pacemaker current in the sinoatrial node. This results in pure heart rate reduction. This can have cardiovascular benefit when added to optimal medical management. It specifically binds the funny channel and reduces the slope for diastolic depolarization and hence prolongs diastolic duration, thereby reducing the sinus rate. The greatest effect occurs when heart rates are highest. Ivabradine does not alter the ventricular repolarization, myocardial contractility, or the blood pressure. Which of the following is not a feature of cardioembolic stroke? A. Gradual onset to maximal neurological deficit. B. Decreased level of consciousness at onset. C. Wernicke's aphasia or global aphasia without hemiparesis. D. Valsalva maneuver at the onset of stroke. E. Co-occurrence of cerebral and systemic emboli. Correct answer A. Gradual onset to maximal neurological deficit. Following features may help in thinking of a cardioembolic etiology for stroke. 1. Sudden onset to maximal neurological deficit. 2. Decreased level of consciousness at onset. 3. Wernicke's aphasia or global aphasia without hemiparesis. 4. A Valsalva maneuver at the onset of stroke can facilitate right-left shunt across a patent foramen veil and consequently paradoxical emboli originating in the right side of the circulation and terminating in left side of the circulation. Most common sustained arrhythmia: A. Atrial fibrillation. B. AV nodal reentrant tachycardia. C. Ventricular tachycardia. D. Atrial flutter. Correct answer A. Atrial fibrillation. Atrial fibrillation is the most common sustained arrhythmia, the prevalence of which increases as age advances. Commonest arrhythmia in children would be respiratory sinus arrhythmia and adults isolated ventricular ectopic beats. The first gene to be found defective in Brugada syndrome was A. SCN5A, B. GPD1L, C. CACNA1C, D. CACNB2. Correct answer A. SCN5A. Brugada syndrome is an inherited arrhythmogenic syndrome with life-threatening ventricular arrhythmias, right bundle branch block pattern, and ST segment elevation in right precordial leads. The first gene abnormality to be described was in SCN5A, the sodium channel gene. This has been designated as Brugada syndrome 1. Which of the following can be used to monitor for arrhythmia over a long period? A. Implantable loop recorder. B. External loop recorder. C. Holter monitoring. D. Telemetry monitoring. Correct answer A. Implantable loop recorder. Implantable loop recorders can be used for up to 3 years. Telemetry monitoring is usually for pre-discharge monitoring in hospital. Holters are typically used for 24 to 48 hours and external loop recorders for about a week. Standard loading dose of aspirin in acute coronary syndrome: A. 150 mg, B. 300 mg, C. 450 mg, D. 600 mg. Correct answer B. 300 mg. Standard loading dose of aspirin and clopidogrel in acute coronary syndrome is 300 mg. Ideally, the first dose of aspirin has to be chewed to enhance buccal absorption with faster onset of action. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.